Okay, welcome everyone to the Healthcare Supply Chain Hub. This is Angelique Beslic, and we are doing our Learning Bites, which we do every Tuesday and Thursday at 3:30 p.m. Pacific Standard Time. 30 minutes of free weekly learnings with hot topics. And what you get from that is the recording, you get the PowerPoint, and then you get a massive action checklist when we're done. So, welcome to today's, and I'm going to get moving on our topic today. So, our topic today is kind of like alphabet soup. As a kid, I always loved alphabet soup, always tried to spell my full name, which is almost impossible. But if we are looking at strategic sourcing and contracting, we have alphabet soup. When we're talking about RFPs, RFIs, RFQs, there's others, but those are the main ones we use in healthcare supply chain today. And it is like alphabet soup. So when we use each, I want to explain to you today, when do we use each, why it matters, how it gets better outcomes if you're using the right one, kind of how to teach your stakeholders all about these. And I'm hopeful that you could actually take this and then share it with your stakeholders as a hey, learn more about these in strategic sourcing and contracting. So let's get rocking. All right, so some key takeaways. I want you to understand the intent behind each one, right? And I want you to understand, how to spot the common mistakes that like really derail sourcing events because of RFPs, RFIs, and RFQs, especially when it comes to stakeholders. So we really have to do some stakeholder training around that. I want to also go through how to read the market before you bid it, because you want to make sure you're doing this at the right timing. Also, discover the secret ingredient of high quality response from all your vendors. And hey, suppliers out there that are listening to this call today, same with you. You want to make sure you're giving high quality responses so that you're getting noticed. And then turn every initiative or sourcing event into strategy, not just a transaction. You know me, I talk all the time about transactional versus strategic. I'm wanting you guys to be strategic. That is the purpose of everything that I do. So this is no different today. All right, so let's break down the three players we're talking about, right? So RFI is a request for information. I'm going to go into these into detail, but that is just what it stands for. RFQ is a request for a quote, a quotation. And then an RFP is an actual request for a proposal, a full-blown proposal, okay? Getting into more detail of all three of them. RFI, this is your information gathering stage. When you're exploring the market, new technologies, new equipment, no pricing yet. You're just doing a discovery. You're getting information about the equipment. You're getting information for your stakeholders, for your clinicians, for your surgeons, trying to figure out what does that thing do? Why would I be interested in implementing that at my health system? Nothing to do with, I don't want anything salesy. I don't want any kind of huge dictation or book on the product. I don't want a catalog. What I'm looking for is, I don't even want white papers, suppliers. I'm just going to tell you that right now. I don't want that yet. What does it do? What's the scope of what it does? I'm trying to get that over to my stakeholders and my clinicians. So it's just informational only. And like I said, no humongous catalog because no one's going to read that yet unless people are asking for that, but definitely no pricing. So then we move into the RFQ, which is that really the request for the quote is the pricing comparison. And we do this sometimes up front to say, for budgetary reasons. Hey, can I even afford this thing? I don't want to do a full-blown RFP if I can't even get a budget approved from my capital team for something like this. So this is really you doing your pricing comparison, little pricing shopping for your budgetary reasons. So when the specs are defined, you understand of the scope of what the thing does, and you want competitive quotes, lowest, cost of apples to apples, really just saying, hey, trying to get to a budget. I'm probably going to take the cheapest number as my budget and then maybe add about 10% just for accessories or some kind of a buffer. I'm hoping that through the capital process, you guys do have a percentage as a buffer to cover yourself, because everyone knows that through an implementation of any type of equipment, especially or technology, we forgot to buy X, Y, or Z. So we always make sure that when we're doing a budgetary quote ask for pricing from a vendor, that we are making sure that we add a buffer to that pricing when we're asking for budgeting, because we all know that when it comes to implementation, that cost that we thought it was going to be never ends up being that. So I always want you guys to add a buffer, minimum of 10%. Sometimes I do 15, 20% when I try to get a quote. I'll add a buffer to it. Then I hand that pricing off to my capital team, who's going to go ask senior leadership for that funding in that budget, or they may go get board approval or whatever needs to happen. But make sure you're buffering that quote. Then now you're ready for full solution selection. You're going to do an RFP. This is when you need to have strategy from your stakeholders to really say, what kind of questions do we want to ask now that we're trying to compare truly apples to apples? I got my costs, that's one thing, but costs are driven by accessories and bells and whistles and all the things that that piece of equipment or that technology can or cannot do. And if you're going out for an RFP and you're having this thing that you're going out to do an RFP for, replacing something, you want to make sure that you're replacing apples to apples. Can it do what your old system did? Can it do what your old piece of equipment did? That's a must have. And then, hey, what are the other things that it does? What does partnership look like with this new vendor? What does their innovation look like? How many upgrades do I need to do to that piece of equipment? How do I need to service it? How do I get that supply? Can I get it through my distributor, or do I have to get it direct only from the supplier? And they have to send it to me on a FedEx truck. Tons of questions that you want to be asking through that RFP process. Now, the complication of your RFP questions can get very complicated when you're doing a technology. Let's just say your entire IS or IT department may have an entire section of technology questions that need to be asked, especially for cybersecurity risk. They're trying to make sure, can it integrate with current systems? How does that work? What does that integration look like? Is it API? All these, different questions that may be being asked by your IS or your IT department. Those things are important. Now, if it's a piece of equipment, maybe your biomed or clinical engineering team has a set of questions. How often will you come in, supplier or vendor, to service the piece of equipment? Does that cost me money? Can my team get trained to service the piece of equipment? What does that look like? Does that cost me money? Is there education for our nursing staff to learn how to use the piece of equipment? All these things, it can get very complicated. Your RFP could be very long depending on the complexity of what you are going out for RFP. Now, if it's a commodity item like syringes, or you're going out for RFP for spine implants versus a new ERP system, that those things get very, very complex. Now, probably the most complex RFP you're going to do in healthcare supply chain is finding a new distributor. That is a very, very long process. Those RFP questions should be very robust. And if any of you guys ever need a template of, hundreds of questions to do a distribution RFP, let me know. But do you see how the complexity of what you're going after to buy can really define how many questions should be in your RFP? And so it really just kind of depends. And you guys can always reach out to me on LinkedIn or on the website or an email and just say, hey, we're going out for an RFP for this. What are some of your suggestions? Or do you have a template for that? Or what can you help me try to figure out what are some of the top 5 things we should be looking for or such? So those are the 3 alphabet soup: RFI, RFQ, and RFP, just a little bit deeper. So then really diving deep into each one of these, when I think about the RFI, it is a tool for fact finding. And it's often used when a company is considering a significant change. They really want to understand, hey, can we afford to do this change right now? Is this going to take us a long time to implement? You're going to be asking like some of those type of questions like, hey, should I even be doing this project right now? The benefits of it is it's low risk way to gather information about the market, potential vendors, what are people saying. I'll be honest, I use Gartner a lot to ping information off of and just say, hey, how's the market feeling in this category or in this technology or with this piece of equipment. I also will reach out to Accenture has a program that was called ClearEdge that they purchased for IS and IT work and technology. I'll reach out to them and say, hey, what is your team seeing for the industry in this area? And if they say, whoa, do not go out for RFP right now for that.
Hello.
There is a huge,
Hello.
hi there, this is Angelique. I can hear you. Um, Okay, so there is so using ClearEdge from an ISIT standpoint is good, and also using Gartner, they can kind of tell you, hey, what is going on in the industry? Is it a good time to go out for RFP? They can tell you if like they know ahead of time of new technologies coming out or new innovations coming out. So maybe now is not a good time to do an RFP for something, and that's always really good market insight. Then for your request for proposal, that provides the detailed list of requirements that are needed for your project specifically, and even more specifically to your health system. And it invites those potential suppliers to propose their solutions, but also communicate the company's needs and expectations clearly and reducing the risk of any type of misunderstanding. When I see an RFP go out for anything that's only like 10 questions, don't even bother. Okay. If your RFP template is 25 questions, I would say don't even bother. RFPs are really your tool for fact finding and all of your scope and requirements for your project or for your initiative. They should be 50 to 100 to 150 questions. If I was doing an RFP for distribution, I probably in my RFP for distribution template I have is about 250 to 300 questions because that's what's going to get me the information I need to choose a vendor in that space. Usually my technology RFPs, I'd say 150, 175 questions, because I have a lot of technology questions that go along with it from cybersecurity standpoint and such. So please make sure that you're doing justice there. And then for your request for quote, It's used when companies know exactly what they need, right? Used for straightforward purchases, quick and efficient way to obtain detailed price quotes, especially for budgetary purposes. If you are trying to go buy a piece of equipment, you don't have a system standard already, you need to get that capital budget on the books. You need your board to approve you getting a new MRI machine or something. You can request quotes also for budgetary purposes. So I just want to make sure everyone realizes that. All right, so some problems that kind of come in with RFPs, RFIs, RFQs. Many sourcing teams out there treat them interchangeably and have not done training with their key stakeholders who do a lot of purchasing, maybe CNO, chief nursing officers, clinical engineering teams, IS teams, have not done training on what each of these are and what each of them do. So if you guys want to just go take my training and you want to go train your team with it, feel free, because your stakeholders have to understand what these are used for, and they are not interchangeable. And then the result of that, suppliers get very confused. If you're trying to ask for an entire bid process, but you're sending them an RFQ, that's very, very confusing. It wastes time. It also weakens your comparison. I'll be honest, I also think it takes away some of your negotiation power because you're not being very clear with your suppliers. And we're turning that chaos right now into clarity when you know which template you're supposed to use from the get-go. The other thing I'm going to say is I've heard this from the supplier community about ghosting suppliers after an RFP is sent out. Please be strategic and do not ghost a supplier. It's, first of all, not very nice, but they put in a lot of time to answer your 50, 75 questions. It takes a long time to do that. It respectfully, you should let them know if they at least received the award or not. But why? What are some of the things they could do better? What maybe did your stakeholder team not like about the product that maybe they could take back to their R&D folks or their research and development folks? Please make sure not to ghost suppliers when you're doing an RFP. It's just a very, very professional thing that you need to think about. So some real world impact. Vendors submit mismatched proposals if you sent them the wrong template, right? So I would say that I have seen, well, first of all, I've seen strategic sourcing teams send out an RFP template and then say, oh, shoot, I sent you the wrong one. I sent you the one for a technology, but this is a piece of equipment for the OR. Okay. So I've seen some of that happen, right? Evaluations dragging on for months. If you're out there doing a demo of a piece of technology or you're doing an evaluation of a medical device and dragging that on for months and months and months. Now, mind you, I do believe you need to take the time that it takes to realize, is this going to work for us or not? Is this going to work for our patients or not? That is a must. And so I say at least 90 days, okay? But to drag it on past 6 months, a year, how many cases do you need to utilize for a baseline? Okay. Pricing becoming the only differentiator. I know that there are some of us that are not doing the quadruple aim, where your decision-making process is cost, quality, outcomes, satisfaction of staff and patient. I know there's many of you out there that are not doing quadruple aim in your decision-making governance. But this is what supply chain gets a bad rap for, that the only thing that this is part of your decision-making governance is the price. Not when you are matching a technology versus a technology or a distributor versus a distributor. There's hundreds of aspects of those relationships that need to be looked at with a magnifying glass, not just price. And when it comes to a distributor, I'm going to tell everyone right now, all three of the main ones, Cardinal, Owens, Medline, all can distribute goods for you. The price that they do that at is very negotiable. It is the other value that you get out of your distributor that you need to be optimizing and maximizing the heck out of for the next several years. And that is what a 50-50 strategic relationship is all about. So I'm hoping you are not making decisions from an RFP just based on price and having innovation getting left off the table. How many times are you asking in an RFP, hey, what is the newest version coming out and when? Because all of a sudden you make a decision in an RFP process for a product, and then they tell you 8 months later that, sorry, that monitor you just bought is obsolete. I just went through a whole RFP. It took me 6 months and I chose you. Well, I didn't ever ask that question in my RFP, did I? That has actually happened to a team that I know. That is actually a real world scenario. So you can't run strategic sourcing on tactical tools. You need to be asking the right questions. And if you have a group of stakeholders that are with you, that are helping to build that set of RFP questions, these are all the things that you want to be thinking about in your mind. So here's an example scenario where this team really needs to figure out how to read the market. So the scenario was your team wants to explore an AI-based inventory management tool. The wrong move would be just to launch an RFP immediately. The right move would be to start with an RFI to assess market capabilities, then shortlist that for the RFP. And this is where I tell you, reach out to Gartner, reach out to Accenture, ClearEdge, right? Especially with technologies. And go look and see what the market is doing first before you just jump right in. Oh, I saw it at a conference. Oh, I like the sales rep. He took me out to dinner. No, 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 no. You've got to be able to do this the right way. So strategic sequencing saves time, it increases clarity, and it strengthens those supplier relationships. So read the market first. That is, kind of a scenario where people could have shortfalls. Common other mistakes. Using an RFP when you just need pricing. I've seen people do that. Using an RFQ when innovation is the goal. So really, if you sat down with your stakeholders and they said, we want the latest, greatest technology for cardiovascular, and innovation is key because we're losing patients to our competitor across the road, and you use an RFQ. That is literally not listening to our stakeholders and doing something completely different, right? Copy pasting templates from past events. I know that we have RFP templates as health systems. I know that. But every single RFP is different. Every single one. And you really need to understand the scope and requirements for every single RFP you go out for. You can copy some of those things, okay, from those. Now, if I gave you a distribution RFP, many of the questions are on there are specific to a distribution. But if you're using a template for cardiorhythm management and you're doing a spine initiative, you're probably not going to copy and paste that directly over. The questions and the need for cardio rhythm management is completely different than spine implants or neuro, right? Neuro ortho. Skipping stakeholder alignment before issuing your RFP. Stakeholders need to be at the table reviewing your RFP questions. It's very important. And then the other one, you can't expect strategic outcomes from these tactical habits. Once again, I really want to make sure that we are being purposeful in sending out an RFQ, an RFI, or an RFP. So thinking about this whole movement from transactional to strategic, right? Because we're talking about strategic sourcing and contracting. Years ago, I could call it contracting or a contract administration team because they just pencil push a lot of renewals and just pricing, right? I could pencil push negotiations like that all day. But in the new world with value-based care model, we must be doing strategic sourcing and contracting. And strategic sourcing goes hand in hand with value analysis. So you're moving from the speed, right? Timed execution, quickly, get a better price, to now strategy. Hey, stakeholders, what is the best product to use on our patients and why? Is it driving patient outcomes on the back end? That's value-based care. Total cost of ownership of the product. Is there going to be a lot of waste on the back end? Is it affecting our reimbursement rates because it's affecting patient outcomes? Thinking about moving away from forms, just tactical forms for these things, to a framework that I actually worked with a group of stakeholders, and we had a project team. We had a kickoff meeting. We've had subsequent meetings, and we feel that our RFP template is outstanding for this product category. Moving from compliance to commitment. I am committing to working on this initiative. My team is all in to work on it. I'm not going to ghost a vendor when I've chosen my award. I'm going to ask the vendor more clarifying questions. I'm going to be more strategic, and I'm going to be committed to the initiative. And then we're moving from activity to actual impact. And this is where I go back to saying total cost of ownership is super important when you're going out to go for an RFP. And this is how supply chain actually earns its seat at the table, because you're showing more value than just the price. And when we talk about total cost of ownership, it is not just the cost of the product. Am I actually missing, or do I have reimbursement penalties because I chose the wrong product and it is the root cause of some of my patient outcomes issues, length of stay, readmissions, post-care infections? Is it because of that piece of equipment or that device, right? Total cost of ownership. So I'm going to show you guys, and if any of you guys have taken my certification in strategic sourcing and contracting yet, or if you haven't, you will have seen this model in there. I teach this in depth in that certification process, but all of you guys should know this. This is the 7-step sourcing process. This is actually just supply chain 101, by the way. This is not healthcare specific. This is any sourcing in retail, manufacturing, a car line, Starbucks. They all use the 7-step sourcing process when they're going out to buy raw materials or whatever they're purchasing. I could be purchasing potato chips on aisle 17 for Target. I'm using the 7-step sourcing process. This is just industry supply chain, okay? But these are the 7 steps that you take for your sourcing process. So you're identifying the opportunity, you're developing your category profile, you're developing your sourcing strategy. That is where you're developing your RFP questions, all those things. Identifying your selection factors, your screening suppliers, and then you're conducting your RFP. But look at how much work goes into before you conduct your RFP. Any industry is doing the same thing. They're not conducting their RFP first. They're doing all these other 4 things beforehand. And that goes into data collection and analysis up there in the gray, opportunity development before negotiation. And so I don't even do my RFP until I've done those things. And that all has to be done with their stakeholders. Okay. So I always give you guys a massive action checklist that you can start tomorrow using. So you see a huge impact. We're going to build the muscle memory for smarter sourcing is what we're going to do. We're going to define our objectives. We're going to match it with the correct R type document. We're going to be aligning our stakeholders. We're going to design our evaluation framework, whether we're going to do an evaluation of a product or a demo of a technology, and we're going to measure outcomes and lessons learned. We're going to be doing scorecards. If you're going to do a demo or evaluation and you're going to do an RFP, you should be scoring the RFP. You want to make sure that you don't go out for RFP. You get 8 different supplier bids and then you don't scorecard it. All right. You need to make sure you're scorecarding your RFPs, and you need to make sure that you're measuring your outcomes and your lessons learned from your proposals that you get from your suppliers. So I'm going to be sending you guys that massive action checklist today after the call. Has a lot more steps than this. This is just a summary of the steps, but we're going to get you guys locked in. So, some hot final thoughts. Are you guys ready to elevate your sourcing game? Don't just send documents. I want you to be sending a strategy. So, if you guys are interested, I want you to join our full certification for deeper dives into sourcing playbooks, evaluation frameworks, negotiation toolkits. So, let's turn every RFP into an ROI. So, you guys always know how to get a hold of me, but if you're not getting my emails, with the recording, with the PowerPoint, with the massive action checklist for today, please send me an email. Check out your spam, mark us safe so you get the tools for free. And then, of course, here is my email. If you guys need to get a hold of me and my team, we're always available. There's our website, but please contact us. And if you want to move forward with looking at my certification program, ping me, set up a discovery call, go to my website. There's links all over it to schedule a discovery call with me. I would love to take you guys further in your journey of how to do RFPs properly, but also the whole 7-step strategic sourcing process. I hope you guys had a ton of fun learning today. Please watch for my email with all your free tools. And then I will see you guys on Thursday, where we actually have an amazing guest from Green Security on Thursday. I'll see you guys later. Have a great rest of your day. Bye, everybody.